Hello, everybody. Welcome to another Zoom call. This is recorded after the Zoom call because the recording didn't record on the Zoom call. Wonderful. So I'm re-recording this. I will not have the questions that were asked on the chat. So I apologize for that because they weren't saved. So we got to figure out a different way to record the Zoom calls because over Zoom it seems to mess up about once a month. And that's a little bit of a hassle. So I'm going to figure out another way that we can double record it somehow so we don't lose that Zoom call. All right, let's get started. So just a reminder again, if you have a question, go to our regular website and search for it. We do not have a search bar in the members only site. In the membership site, there's no search bar. We will be working on trying to get that written, but it doesn't exist right now. But go to our regular website and search for it. I may have already created a video on the question that you have. And speaking of the membership site, if you are not on the membership site, well, you're probably not watching this video. So we don't really need to talk about that right now. But this is how you would get on it, by asking to get an invite. Everybody should have got an invite by now. So, all right, let's get to some of the questions. This one, I heard a lot of people, especially seniors and others with kidney problems, my issue, have been injured by contrast dyes. And so this is a question about contrast dyes and how they can be unhealthy for you. So we're talking about contrast dyes for MRI and CT scans. Can a patient do other detoxes like ozone or vitamin C IV or charcoal or something else right after the test to expedite the detoxification of the contrast dye? Well, I wouldn't choose ozone to detox anything. Ozone will help kill biotoxins. It won't help detox a pesticide or contrast dye or a heavy metal or anything like that. Ozone is not a detoxification tool. Vitamin C does help with some things that can be beneficial, but it's certainly not a chelator. What you want is something that will chelate that out. We use a homeopathic chelator, but you could use other chelators as well. But the biggest thing is to support your liver. Make sure you're doing coffee enemas. Make sure you're doing castor oil packs over your liver prior to this, receiving a dye and after receiving a contrast dye, especially if you have any sensitivities to it. Make sure that you look at that. And then, when doing coffee enemas, how much of the liquid is an appropriate amount? I read recently that more than 2 cups can stretch the bowel, and if coffee goes too far, it can begin to strip electrolytes before they get a chance to be reabsorbed back in the body. Well, I don't think any of this is true. So, more than 2 cups stretch the bowel. You have 30 feet of bowel, so that just doesn't make any sense. I don't know where that was written. So whoever wrote that, I am just in total disagreement of that. You can't stretch the bowel, you know, with by doing coffee enemas or any sort of enema. That doesn't even make any physiological sense. And it won't go up very high. So an enema is not going to go up very high. You have normal peristaltic waves that push fluid out, so you're not going to be able to get enema going really too much beyond the upper rectum. So, and you really don't need it to. So no matter how much you put in, you won't. And certainly you're not going to strip electrolytes. So I just totally disagree with that. But you don't really only need 2 cups. And I've always said over and over again, I say that don't get hung up on how much coffee you're getting in your bowel every time you do a coffee enema. Some people get discouraged. I could only get a little bit in and had to go right away. I couldn't hold it more than 30 seconds or 2 minutes, or what am I doing wrong? You're not doing anything wrong. Just keep doing it. You're doing fine. Don't get discouraged if you're having trouble with a coffee enema, you're not getting enough in, you're not holding it long enough, just keep doing it. The purpose of the coffee enema, again, is to stimulate your parasympathetics. It's not to accomplish a task of holding it for 15 minutes and laying on one side and flipping to the other side and doing any of those things. It's just to stimulate the parasympathetics in the rectal area. So, next question. I got a massage yesterday afternoon. Afterward, I had a healthy bowel movement. Then I did my daily coffee enema, which I could hold for only about 7 minutes. This never happens. I always hold the entire 15 minutes. In spite of doing warm-up water enema, which I also could not hold, then a few hours later I had another healthy bowel movement. Could all this extra bowel activity be related to the massage? The other Herx reactions experienced were minor joint pain and slightly lower energy for the remainder of the day, crashing a few hours earlier than normal. I'm wondering if I could be more intentional about getting massages if they're this effective for me in helping remove toxins. Good observation. When you get a massage and you haven't had a massage for a long time, you can flush a lot of toxins out of the muscles and extracellular spaces and the fascia layer, etc. of your body where you have a lot of inflammation, and you can end up with a Herxheimer reaction, what this person is talking about. A Herxheimer reaction is a reaction when you're basically kind of overloading your detox pathways and you just feel cruddy the rest of the day. Some people don't like to get a massage because they don't get them very often and they feel good during the massage, but then they feel cruddy for 2 days afterwards. So the treatment for that is to get a massage more regularly so you can get your tissues more flushed out. The other part of this question is, could all this extra bowel activity be related to the massage? I'd say absolutely, for sure. So when you get a massage, it's very relaxing and very comforting. It stimulates your parasympathetics, and your parasympathetics, like I said in the last slide, are what stimulate your peristaltic activities. Peristalsis in the gut is the movement, contraction of the muscles around the intestinal tract that move your feces through your gut. That's what you want. That's a function of your parasympathetic nervous system. And another reason why you do coffee enemas. Of course, to stimulate your parasympathetics, and one thing that does is it moves your bowel. So, good observation. Yeah, I would say good idea to get a massage more regularly. Next question. The tumor site on the ankle has gotten really painful and enlarged once she started ion foot baths. She had done it every day for the first 4 days, and it hasn't done one for 3 days now, and the site has gone down and it's not painful. Is that a normal reaction when using the foot bath? Too much, or do you think this is something else going on? I guess we're not sure what type of reaction at the tumor sites is normal. I wouldn't say this is normal. I'd say there's something going on. I'd like to see a picture of the tumor site and see the reaction that is happening. In one sense, it could be actually good. Another sense that it could just be irritation and some fluid there. So I'd want to see a picture of that. We should have a chat. I don't know who asked this question, so maybe follow up with me, send me a picture, and we should have a chat. Next question, can high-dose Boswellia, so Boswellia is an anti-inflammatory, it's technically a flavonoid that can reduce inflammation. It would be used to reduce inflammation in the brain. It could be reduce inflammation in the tissues. It's really good for inflammation in the gut. So this person's taking 4,200 milligrams a day. That's very high dose Boswellia. Can it lower platelet count? That's the question. Well, anything that's going to be an anti-inflammatory taken at a really high dose could lower your platelet counts. Yes, because it is going to make your blood less viscous. It's going to make your blood, it's going to thin your blood a little bit. So I had to go off chemo for a week due to low platelet count. Now I'm back on chemo again. However, I would like to take the high-dose Boswellia again due to its great benefits associated with glioblastoma and stem cell apoptosis. I want to take it to reduce some minor inflammation as well that I have outside the tumor resection site. I would say just to go back on it again and maybe prior to chemo, maybe drop your dosage down or don't take it for 3 days prior to chemo and see what your platelet count is, so that you can still get your chemo if that's what you're desiring. So I would try to reduce that dosage around the chemo, and then you can ramp it back up again. On one of the Rife videos, you talk about stopping cancer tumor growth via Rife, which is a big win. You mentioned that it doesn't matter if the body seals away a tumor as it's no longer cancer. So in one of the videos I talk about is that on certain cancers, the tumors can just get walled off. That's common with lung cancer, it's common with brain cancer, it's common with breast cancer, it's common with liver cancer and some pancreatic cancers. That as the body just as it stops replicating, your body doesn't necessarily always clean it up and make it go away. Your body can just wall it off, especially in those cancers that I just mentioned. And I said in this video, I believe something to the like that that's okay, just leave it. Just don't do anything with it. It's not hurting you, just leave it alone. It's stopped replicating. That's really what we want. But the continuation of this question is I'm thinking in the case of colon cancer, if the tumor is actually obstructing the colon, we don't want to just wall it off. We want it to reduce size or be gone. Well, usually that's what does happen with colon cancer, so I don't think we need to be concerned about it. Typically, you don't get so much of a wall off with colon cancer. What other non-surgical methods can you do to address the situation? I'd say just keep on the course and let's see what happens to the tumor. My husband has acute myeloid leukemia and my son has grade 2 glioma. Is there a test for the other 5 members of the family to take to see if we are also at risk? How do we get that done? So you have 2 members of the family with 2 different cancers. You do have to scratch your head and go, what is going on here? So, number 1, there's not a genetic link here. There's no genetic link to AML nor to glioma, so let's cross that off. But there's a difference between genetics and familial. So familial link would be everybody in the family is eating the same food. Everybody in the family is exposed to the same household mold, maybe. Everybody in the family is living in the same house and in the same neighborhood where there's a high degree of toxicity in the water or in the environment. So you got to look at environmental things. I would also kind of do some investigation in the neighborhood if you live in a city on how many other people within a X amount of block radius have been diagnosed with cancer. Is it higher than normal, the state's average? I don't know how you do all that investigation, but there's some things you can look up. There's a website called Scorecard, SCORECARD, and that is a website which lists the toxicity levels of your neighborhood via zip code. So you'd put in your zip code 55082, and it will list the number 1 polluters company-wise in your area and the number 1 pollutants. What chemicals are the number 1 pollutants in your zip code area? This is all because the Environmental Pollution Agency requires companies that emit pollutants to list the types of chemicals that they're polluting because they have to stay below a certain limit, but these things add up. So that's one way to look at it. I know in our neighborhood, in our neck of the woods in Minnesota, their 3M company had years ago in the 60s and 70s and 80s had paid farmers $100 to bury barrels of very, very toxic substances in their field, saying that they won't leach out and we'll give you $100 to bury this. And they said yes, and they buried hundreds of barrels of toxins in various fields around Lake Elmo and Oakdale and Cottage Grove area in Minnesota. Well, those have leaked out into the water, polluting large municipalities of water supplies, causing these municipalities to get very, very costly filters, etc. 3M was sued over this, but damage was done, and damage is still being done. If you have well water and you could be and you're in that aquifer, you could have issues. I know in my office that I used to have years ago in Stillwater, right near that office within a 5 block area, the incidence of cancer were through the roof. And nobody ever figured it out that I know of. I don't know if it was some EMF. This is before early cell phones were big. So I have no idea what it was. They were all in the Stillwater water system, but it was just this 5 block radius where incidence of cancer was really, really high. So some things are very, very difficult to figure out. Some things you can put your finger on it. I had a patient once that he did not have cancer. He came to me for an autoimmune disease, and he lived on a potato farm, and he was like 3rd-generation potato farmer. And I said, so what's it like on a potato farm? He said, well, I actually moved off when I was 20, and he was in his 40s now. He said, my dad made me move away because literally no one in our family, all my aunts and uncles and cousins, all developed cancer before 50. And my dad swears it's because of all the pesticides that you have to use to spray for potato bugs. Potatoes, are one of the dirty dozen list of your foods, and one thing that probably one of the most sprayed vegetables there are, because potato bugs don't die easy and you have to spray them directly in order to kill them, and they come back like crazy if you've ever grown potatoes. So in my potato garden, I'm down picking potato bugs every few days and killing them because we don't use any pesticides. So they're kind of fun to pick and squash if you have gloves on. If you get into that kind of thing. But you have to pick your potato bugs. So they could literally eat all your potato leaves off of your potatoes, and you won't be able to get energy for the growing tubers underneath. So growing organically is difficult, and it takes a lot more effort. So back to this question, the exposure that you may have familial, you're going to have to do some investigation. Could be completely, something you'd never be able to figure out. It could be something that you might be able to put your finger on, but do a little bit of private investigation into the matter. Next question. Energy highs and lows are concerning. 1 week he is out. This person is talking with their husband. 1 week he's out using a chainsaw and doing work. The next week his energy is very low. When should we be concerned? Well, you should be concerned. Can you do anything about it? That's the question. And it really has to do with how low are the lows and are the highs, the days that he's feeling good out working with his chainsaw. Is he more and more sluggish even doing that? Should set up a time that we could talk about this, because if you're noticing a trend, it's the lows are not good when your energy's low, but then when you get your energy back and you're doing well, that's really a good sign. So if he's having these highs and lows, that's a much better sign than just constant lows, obviously. And then watch how low those lows are getting. So maybe set up a time that we can talk. For my non-small cell lung cancer, the oncologist offers a clinical trial that includes Avastin. My understanding is that Avastin shuts down the capillary formation at the tumor, depriving it of its nutrients. Is there a non-drug alternative, one that also suppresses capillary formation? Well, I don't know all the mechanisms of action of Avastin with non-small cell lung cancer, and the studies that are showing that it is beneficial for that. But yes, I do agree that you don't want to increase VEGF formation, which is vascular endothelial growth factor. So the things that you would do from a natural standpoint to reduce VEGF, that vascular growth factor, is to avoid nutrients that contain high amounts of nitric oxide. So remember, a lot of things that you do for cancer are the exact opposite of what you would do for heart disease. So if you have heart disease, coronary artery disease, or some blockage, high blood pressure, you want to increase nitric oxide production. So there's a lot of supplements on the market for that. Also for erectile dysfunction, same thing. You want to increase nitric oxide production because that increases the vascular endothelial growth factor. It will increase the growth of new vessels. You literally can grow new vessels in your heart and bypass, naturally, growing new vessels bypass blocked arteries. And it increases the size of the lumen of the vessel, so it will decrease blood pressure. So nitric oxide is a great supplement for that. But nitric oxide isn't such a great supplement for a person with cancer because nitric oxide increases growth of new blood vessels. And when you have a solid tumor, like a small cell lung cancer, breast cancer, colon cancer, etc., not a blood cancer, but when you have a hard tumor, solid tumor, you don't want to increase vascularization into the tumor because then it's basically giving the tumor new highways for food sources. And so you want to stay away from nitric oxide supplements. So that's why we don't use those with cancer patients. But that's why I also write that you don't want to be making kale shakes when you have a cancer. You can have a little kale in your salad, that's just fine. But you don't blend up a kale shake like you may hear about with people with heart issues or trying anti-aging properties. Kale has the highest amount of nitric oxide of any vegetable, about 4 times as high as spinach. So you would want to avoid doing something like that. EGCG from green tea extract can help decrease VEGF. That would be one natural solution for this as well. Other than castor oil packs, I don't see any liver support on the protocol. Maybe the castor oil packs are enough. I get the impression his liver, this person's talking about their child, his liver is taxed. He does 1 castor oil pack per day. I've done them twice per day on occasion. He gets very angry sometimes. This used to happen after I gave him the Adex. Adex is a homeopath chelator for different toxins. I started only giving him Adex when he was on a castor oil pack, and that helped. I only give him a partial spray of Adex now, and that helps too. It seems like the castor oil packs are having less effectiveness on his anger. So yes, you do want to support the liver detox pathways, but you want to keep an eye on everything downstream. So remember, go back to that 7 phases of detox, and we're talking with liver as phase 1 and 2 and 3. Well, you need to support 4, 5, 6 also. So make sure he's able to empty the liver, and that's one of the great things about just hot packs. Even if you won't do castor oil, just do a hot pack over his liver. He might be much more inclined to allow you to do that with him, and it can have just a great result of just helping the bile become less viscous, helping motion of the bile, helping the liver to be able to drain. And that could be a great thing. Plus, remember, in your RIFE programs that I've created, there is liver detoxification frequencies as well. Hi, Dr. Connors. Is it normal for my hammer bulb to get super hot while I sleep with it? I try to sleep with it either on my chest or right next to me, but sometimes I need to place it back on its stand because it gets too hot. Yes, it does get warm while you sleep with it, but good news is that I have created a new version 6 with different duty cycles for all your frequencies. So everybody with an F122, the last 3 days I shipped out new programs to everybody that was on my list. So if you don't get a program by the end of May, and you have an F-22, to contact the office so that I get that created for you. So I've been working very diligently on that for the last couple weeks, and have gotten very little sleep. But I want you guys to have the best programs. These are going to be stronger programs, and they won't cause the bulb to get so hot. So when you get this new flash drive, I put some instructions in there with how to put it in your computer. I put a little half sheet on why I'm giving you this new update. I want you to use the new update. So when you get this, put it in your computer and start using these new programs. Okay, so don't call the office and say they're different, because they are different. Yes, they're different, and they are shorter, meaning that there's not shorter in length for the day, but they're only 1 week programs. So I'm changing everybody's to only 1 week programs. You're not going to have 2 weeks or 3 week programs anymore. You're having 1 week programs, and they're new Ion Cleanse Pro Wave programs as well, with different duty cycles. Use these new ones, please, and start using them right away. That's going to help solve this heat problem, and it's going to be much more powerful and much more beneficial for everybody. So I'm very excited about that. We are constantly trying to give you the best service possible and to give you the best product possible. I want you to win in this endeavor, and so we're just constantly trying to improve. Thank you for this, and I apologize that didn't get recorded. We're going to try to find a different program to record Zoom, because Zoom, I think it's just because it's so overused that sometimes it just doesn't work right. All right, thanks. Bye-bye.